Do you know what typhoid fever is and how it can affect you? This is a question many of us might not have pondered upon, yet it's crucial to understand this bacterial infection that can have a significant impact on health. Typhoid fever is an illness caused by a type of bacteria known as Salmonella Typhi. This bacterium is not a friendly visitor. It's a troublemaker that enters the human body most commonly through contaminated food or water. It's a classic case of what goes in must come out. Unfortunately, in this scenario, what comes out is a range of uncomfortable and potentially dangerous symptoms. The initial signs of typhoid fever can be quite deceptive, as they often mimic other common illnesses. It starts with a high fever, often reaching up to 40 degrees Celsius. This fever is typically accompanied by weakness, a feeling that can make the simplest tasks seem like climbing Mount Everest. The bacterium also likes to stir up trouble in the stomach, leading to abdominal pain and discomfort. In some cases, a rash may also appear, giving the skin a spotty appearance. Diagnosing typhoid fever isn't a process of guesswork. It requires concrete evidence obtained through blood or stool tests. These tests can detect the presence of the Salmonella Typhi bacteria, providing a definitive answer to the question of whether typhoid fever is the culprit behind the symptoms. Once the diagnosis is confirmed, the battle against the bacteria begins. The weapon of choice in this fight is usually antibiotics, specifically drugs like ceftriaxone or cefixime. These antibiotics target the bacteria, aiming to knock them out and restore health to the body. It's also crucial to stay adequately hydrated and rest as much as possible. In severe cases, the fight might need to be taken to a higher level, with hospitalization becoming necessary. Prevention is always better than cure, and this is particularly true for typhoid fever. One of the most effective ways to prevent this illness is through vaccination. Practicing good hygiene, such as washing hands regularly, is another excellent method of prevention. It's also wise to be cautious about the source of your food and water, avoiding anything that might be potentially risky. In summary, typhoid fever is a bacterial infection that is contracted through contaminated food or water. Its symptoms include high fever, weakness, stomach pain, and sometimes a rash. Diagnosis is confirmed through blood or stool tests, and treatment involves the use of antibiotics, hydration, and rest. In severe cases, hospitalization may be required. Prevention methods include vaccination, good hygiene, and being cautious about food and water sources. Remember, knowledge is power. The more you know about typhoid fever, the better equipped you'll be to prevent it and seek prompt treatment if necessary. Always consult a healthcare professional for personalized advice. Stay informed, stay healthy.